Hey, I'm Di McQueen, licensed clinical social worker, family and addiction expert. I'm here with Dr. Brian Jackson, my longtime cohort who specializes in the field of addiction. Welcome to Healing Families Shattered by Addiction.
Di and I have worked with addicts, alcoholics, and their families for over 30 years combined. Our podcast and coaching programs focus on families who have a loved one suffering from addiction. Our experience has been that this disease affects families as much, if not more, than the addict or alcoholic.
Is your world spinning out of control? Are you codependent? Are you experiencing worry, loss of sleep, and difficulty concentrating? If so, you're in the right place. Brian and I have both personally lived it, learned it, and now we're going to teach you tools and techniques on how to get your life back that you thought was shattered by addiction.
Okay, let's dive in.
Brian and I are so excited to introduce to you our new sponsor, Lakeview Health. They are a wonderful residential treatment center. Whether it's the family member who is looking for a place or the addict or alcoholic themselves, this would be the place that we would refer them to. Brian, you have many years of experience with Lakeview.
Yeah, Lakeview Health is a center of excellent addiction treatment. They take an evidence-based approach, medical approach to treating this complex brain disease. They hold the Joint Commission's Golden Seal, and they were voted one of America's best treatment centers by Newsweek magazine. They deliver dual diagnosis, gender-responsive, and trauma-informed care at their gorgeous facility here in Jacksonville, Florida. But they do see people from all over the world do come here to Jacksonville to go to treatment at Lakeview. Their levels of care include medically supervised detox, which a lot of people do need. Then they stabilize them in a residential rehabilitation and partial hospitalization program. They have board-certified physicians, master-level therapists, and they work to address the unique needs of each patient. So in other words, it's not a cookie-cutter program. They help individuals build skills for long-term sobriety. So if you or someone you know needs treatment, please visit their site at lakeviewhealth.com. We also have a hyperlink on our website at familyandaddictionexperts.com where you can just click and get some information about Lakeview Health. And Di, I think you have a number for people to call if they would like to inquire about treatment.
I sure do. That number is 888-480-3799. That's 888-480-3799. Give them a call. Hey everybody, this is Di McQueen, and I wanted to welcome you back to Healing Families Shattered by Addiction. Today I wanted to talk a little bit about Alcohol Awareness Month. April is Alcohol Awareness Month, and I thought it might be helpful to kind of just talk a little bit and give you some understanding about why we have to become aware of alcohol and its impact on health and society. So I thought I'd just kind of start by introducing that and then lead into how sometimes we don't even realize the effects that this, addiction happens to have on families, and how maybe we can see a little bit broader into that picture, and then also understand maybe how I can, influence my loved one, or try to at least influence my loved one, but seek some help. And if not, at least understand that you, the family, can seek some help. So Alcohol Awareness Month is a wonderful opportunity to update our knowledge about alcohol use disorder and impacts it has. Believe it or not, there is over 140,000 people per year that die from alcohol misuse. That's catastrophic. And when you think about it, opioids is rivaling it, but it's not there yet. So it's still probably about our number one killer out there, especially for things that are preventable. Alcohol misuse is linked to over more than 200 different diseases and injury-related conditions that cost us dearly. And there is an estimate of about $249 billion that it costs U.S. citizens because of alcohol misuse. We now have, probably about 10 to 12% of our population that's 12 to 20 years old are using and abusing. 16.9 million people in that age range consider themselves to be heavy drinkers. these are staggering numbers when you think about it. And it's really, um, really, really devastating as things continue to increase. I could get into statistics on different races, different creeds, different nationalities, men and women, etc. But I think I'd probably bore you all to death. But nonetheless, what I'm trying to say is that it affects everybody. Nobody's immune to this. Um, so there's a lot of research out there. There's a lot of ways that we can actually learn to help, someone that we love, or help ourselves. And that's a really important bit of information. You can also find information on the National Institute of Alcohol Abuse and Alcoholism on their website to learn more about how the research and initiatives to generate and disseminate fundamental knowledge about this. So in the U.S., there's guidelines for drinking. Our guidelines in America state that adults of legal drinking age can choose not to drink or to drink in moderation by limiting themselves to 2 drinks a day or less for men, 1 drink a day or less for women. And so that's staggering when you think about it, because how many of us go out for a glass of wine with dinner and soon it turns into 2 or 3? I don't think that most people really understand how easily we can get involved in something that seems to be just a no-brainer, but it's really not. It's one of those, we're talking about a very small amount of alcohol and we can get into a troublesome state. When drinking in moderation is still too much, it would be, when someone has something like a medication interaction with alcohol, it would be advisable that you don't drink. Medical conditions that can be worsened by drinking, of course, under the age of 21. If you are recovering from an alcohol use disorder or unable to control the amount you drink, and pregnant or might be pregnant. It's, there's other things. Maybe you are an older adult, you're planning to drive a vehicle or operate your steering. You have activities that require coordination, skill, and alertness. Really should be those people that we should try our best to avoid drinking alcohol. It's really one of those things that we think it's no big deal, but it really, really is a huge deal. The next question that comes up to us often, and Brian and I talk about this quite regularly, is why is it different for women than it is for men? And there's a very simple answer to that question, which is, the susceptibility for short and long-term consequences for women tends to be higher. And the reason is it's predominantly in the body water. Women, pound for pound, have less water in their bodies than men do, which means they metabolize it differently, and it tends to be harder on them because they don't have as much water in their system. So there is a much greater risk for harm, and harm means to, our liver, to cardiovascular disease, neurotoxicity, I can't say the word, and alcohol-related memory blackouts. That doesn't mean men are immune. What it does mean is that it's more troublesome for women based on just that they're smaller and pound, they're usually more susceptible. What do we consider alcohol misuse? That includes binge drinking, heavy drinking, increasing risk from harmful consequences, including alcohol use disorder. The more drinks in any day, obviously, the more ability that you have to become susceptible to alcohol use disorder. So, the definition really amounts to that if you have 0.08% or 0.08 grams of alcohol per deciliter or higher, you are in a place where you're consuming too much alcohol. So what does that equal? That basically means that men can consume no more than 4 drinks a day or 14 drinks a week, and women 3 drinks a day or 7 per week. If you're using more than that, you need to really start to consider what is going on and what might be happening. There's some, it sounds good that you can hold your liquor, but in fact, that's not necessarily such a great thing. I used to think that was like a big deal that I could drink everybody under the table. Um, in fact, I found out that, oh, that's not good at all. It's not good at all, which means I'm building up tolerance. And when you have tolerance, we think that's a badge of honor, but it really is not. It means that my body needs more and more and more to get the effect that it's trying to achieve. Um, the other, unfortunate part of that is being able to hold your liquor, especially if you are pregnant, means that there is a high probability that there's prenatal alcohol exposure, and that can result in brain damage or serious other problems in babies and fetal alcohol syndrome or spectrum disorders, which, those can result in lifelong physical, cognitive, or behavioral problems for children. And it seems so unfair, right? It's not their fault. And unfortunately, they didn't really have a choice in that. So that's something to think about. Um, Alcohol use disorder is really characterized by the impaired ability to stop or control alcohol use despite adverse social, occupational, or health consequences. And there is a lot of health consequences out there. I mean, there's a lot of things that are really, really directly related to alcohol use disorder. Examples: liver disease, cardiovascular, major depression, stomach bleeding, cancers, sometimes esophageal cancer, oral cancers, liver and rectum cancers. A lot of these things are directly related to alcohol use disorder. Additionally, things like sleep disorders. Oh, yeah, that's a big one, where your body's waking you up in the middle of the night because it's having, cravings for sugar. Also, high blood pressure, pain, diabetes, the inability to have, engage in safe sex, or even, some erectile dysfunction. So there's a lot that can be happening there, and things that we should really pay attention to. Anyway, alcohol use disorder. It's long-lasting changes in our brain, and it becomes vulnerable to relapse, right? And we believe, Brian and I strongly believe, that addiction is a chronic brain-based disorder that involves brain chemistry, the environment, life experiences, and genetics. I think that, sometimes we have ways to cope, and as we begin to cope, we find something that numbs us out, and helps us not have to deal with life on life's terms. Many of our negative consequences affect our health, well-being, family, friends, and other loved ones. And that's a big deal, right? So addiction is one of those things that, despite the negative consequences, we continue to do what we're doing, and it really doesn't matter. So some symptoms that we might want to look for, and you can ask yourself these questions and say, hey, this might be something I really need to pay attention to. Had times when you ended up drinking more or longer than you intended to. This is something to look for. So over the past year, have you done that? More than once you wanted to cut down or stop drinking. You tried, but you couldn't do it. You spent a lot of time drinking, being sick from drinking, or getting over the after effects of a hangover or just that fog. Wanted to drink so badly that you couldn't think of anything else, or you couldn't wait until the end of the workday, and about 4 o'clock you start getting that craving. I can't stand it anymore, and I can't wait to get out of here. Found that drinking or being sick from drinking often interfered with taking care of yourself, your home, your family, or caused job problems, or if you're younger, maybe school problems. Continue to drink even though it was causing trouble within your family or amongst your friends. Given up or cut back on activities that were important to you or interesting to you, gave you pleasure in order to drink. So unless there was something drinking involved, all of a sudden that was boring. I don't want to do that anymore. Playing flag football with my friends, forget that. That's too hard. I'd rather go out and drink, right? But if there's drinking involved, I could make it there. More than once gotten into situations while or after drinking that increased your chances of getting hurt, such as driving, swimming, using machinery, walking in a dangerous area, or exchanging in unsafe sexual behavior. You continued to drink even though it was making you feel depressed or anxious or adding to another health problem. Or after having had an alcohol related memory blackout, you got up the next day and drank again. Had to drink much more than you once did to get the same effect you wanted, or found that your usual number of drinks had much less effect on you than it did before. And lastly, found that when the effects of alcohol were wearing off, you often began to have withdrawal symptoms such as trouble sleeping, shakiness, restlessness, nausea, sweating, a racing heart, dysphoria, which is that feeling of uneasiness or being unhappy, malaise, just a general sense of being unwell, feeling low, or having a seizure. Or even worse, you begin to start to get paranoid. So these are a list of questions that, open your eyes to, hey, you know what, if I'm answering yes to probably more than one or two of these things, I might really want to take a look at, do I? Is it possible that I have disorder? I don't think it's something that you should be ashamed of by any stretch of the imagination, but it certainly does mean that we need to pay attention to that. Remember that, when we have an alcohol use disorder, it begins to affect the people we love and the people around us. And loved ones of the people with alcohol use disorder may feel, after a fashion, they start to lose their empathy. They start to get really frustrated as time passes. And then they start to control, right? I mean, that's another thing. They're trying to figure out how to get this person to stop doing whatever they're doing. And the more it goes on, the more frustrated they get because they don't have tools and techniques on how to do these things. We know that it causes financial, social, economic, emotional problems in our lives. And this begins to affect the family as well. Addiction sometimes, it is a genetic linkage. And so we do have predisposition to that if we are someone that came from an alcoholic home. But in addition to that, it's really important that we understand that there's things that family members can do, starting off with trying to be able to note that there's something different going on. For instance, did you notice that somebody has all of a sudden, someone that was really very clean and very neat has become somewhat disheveled, and their grooming is getting, a place where you're like, wait a minute, I haven't really seen that before. Potential weight loss or gain. Their skin looks different. Maybe they're flushed or puffy. They get a little bloaty. Sometimes they're starting to wear darker glasses so they can't, eyes can't be seen. And maybe they actually start to tremor, their hands start to shake or something like that, which obviously leads to that may be further down the road. Irritability, that's a big one. Their mood swings are big and they seem to be, happening more often. Unjustifiable outbursts of anger, being really sad or tearful, like out of the blue, and it didn't really make any sense. Expressions of hopelessness. And a big one is that if they were someone who was pretty active and socially engaged, they become less engaged. Sometimes there's confusion. Obviously, if we're having blackouts, there's memory loss, paranoia, if they're really in a pretty deep disease progression. And it can go all the way to, delusional thinking and hallucinations, but that's usually pretty far on. And hopefully the family has begun to do some work with somebody prior to that. Other things that might be noted is all of a sudden they're having problems at work, they get fired, or just being insubordinate or not showing up, asking you to lie, telling people that, call in for me and tell them I'm sick today. Neglecting their favorite activities. If it's a child at school, they may not be doing their school activities. They may have grade decline or being absent from school or work. That's a big one, where that starts to happen a lot more often. So if you're starting to see these characteristics, I think that it's really important that you understand that there may be something going on, and it's something that is to be noted and paid attention to. So, like I said, most of this stuff happens on, it affects families on an emotional, psychological, financial, and social level. And there's different stages too, right? If it's a parent, and they see this in their child getting drunk, they become like almost obsessed with this child. And so that can be a really hard one too. And I think this last week, Brian and I on Instagram identified a lot of helicoptering. That's not the approach that you really want to take. So we want to go to a different level with that. The flip side of that is if the person is an alcoholic, they may be neglecting their child or, loved ones. And the hardest part, I think, for a lot of family members is the betrayal and the feeling of someone's almost like, having a love affair with something other than them. And, we can't reach them. And that's a very difficult place to be. The biggest part, I think, that a lot of people feel is the shame and embarrassment family members feel when they're out in public. If someone's, intoxicated and acting out, family can start avoiding friends and relatives outside the home. They come up with excuses as to why this is not, like they're not available, because they don't want to be embarrassed or shamed. And it's not something to be embarrassed or ashamed about, but we don't know that when we're first in this. Family members they don't know how to act or react. I think the worst part of most of this is that, the addiction undermines the love, the trust, and what is needed to sustain a healthy family. So children might be forced in to be in the parent when there is no parent, able to independently function. Spouses may hide or lie for their partners, and that becomes a real paradox where, there's a lot of anger involved, and yet at the same time, the codependent behaviors begin to really come out. It becomes very destructive. We try to rescue, we try to save, we try to filter, we try to do all these things to prevent, and we can get to a place of being really, really possessed and obsessed. So it's never easy when we start to see that there is a problem within the family. But it is important in most cases that the problem be addressed, and we want to make sure that we do it in a way that is kind and, something that we want to be sensitive to, at least for sure in the beginning, right? So asking your questions about, how do you feel about your life these days? I've noticed that you've been drinking more than usual. I feel frustrated and sad when I can't talk to you because you've been drinking. We found a good rehab center for you. Of course, that's after you have, of course. It's really important that you stay calm and compassionate, and you seek support from others, because you really don't know what's going on inside of this person, but you need to be very clear, So asking sensitive questions, using pronouns like I and we, inclusive, right? We are a family. Have a clear treatment plan ready. So like you have already done the research. If you feel that's necessary, stay calm and compassionate, and seek support from others. Things like Al-Anon, a counselor, maybe someone from your church, fellow travelers, a brother or sister that you happen to know would be, confidential and would be someone that you could confide in. The things we don't want to do is make angry accusations, accusing them of things. And, that doesn't usually go over well. We're going to put someone on the defensive, and it's not going to be a productive conversation. Using you rather than I and we, making bargaining so that you can, allow this bad behavior to continue. Like, okay, if you drink until 7:00, or we just drink, I'll watch you and you can drink 2 drinks tonight instead of 5. That puts you into a very dicey role. First of all, it's you, the controller, and you become mama or daddy. The alcoholic will definitely become very resentful. It's a guarantee. It's a promise, right? So that is not a good place to get into. acting judgmental or outraged. Very hard as we get more and more into this disease. It's very, very, very frustrating. And so we can get into a place of being extremely inconsiderate. And we are, kind of giving them the reason, right? Because the alcoholic really wants to have a reason to go ahead and use again. And you don't want to be the reason that they can blame you for that. And trying to tackle this problem by yourself. Our best thinking gets us into a lot of trouble. So it's really important that you consult, other people that have dealt with this before, a rehab center, a counselor, and try not to handle this on your own. It is, very frustrating, and a lot of the things that we think that are really helpful are not helpful at all. And, we can get into a lot more than that. One of these things is once we get into this place, we definitely have to have, the ability to make some and set some boundaries and, come up with a plan of action that's going to be very viable for us. So, it's really important that you seek some outside intervention. Like I said, if you happen to have a treatment center that obviously getting a hold of their insurance or providing a treatment center with some information so that you can be set up and ready to go and present it to your person and let them know that you've already got something lined up, and that, it would be really helpful. Clergy people, an Al-Anon group, family members that have gone through this before, and certainly, and most importantly, probably a family therapist that understands, addiction as well, that can help you get through that. So I hope this is really helpful in our Alcohol Awareness Month. Brian and I are here to help in any way that we can. There's so many tools and techniques. It's a hard place to be. It's a very sad place to be and a very lonely place to be until you recognize there's actually lots of good things that can be done in relatively short period of time to empower you and help you get out of that place of feeling like there's nowhere else to go, and the dynamics of the destruction of addiction in our families. It is a very, it touches every vein of our being. And unfortunately, the family suffers a lot because they really don't understand what they need to do or how to do it. And so, we keep it in the secrets, in the eaves back there, so nobody really knows what's going on. Bring it out to the light. Recognize there's lots of people that suffer with this affliction and disease, and that it doesn't mean you're, got that scarlet letter on you. It's really important that you understand there's help available, people who really care, lots of people who understand and have been down that road before and with you. Reach out to us at www.familyandaddictionexperts.com. We'd love to help you in any way that we can. We have a resource, some resources on our website. We would be happy to have a free consult with you, and just kind of see what's going on for you and guide you in the right direction if we're not the right people. And, hope that this brings a little bit more light to, the affliction of alcoholism in our society today, which is extremely a big deal these days out there. And we want to bring awareness so that we can start to curb that problem and recognize that even though alcohol is legal in this country, and yes, there are many people that can drink moderation, there are many, many that cannot. And we need to be aware of that and help in any way that we can. But more importantly, we want to also help those people that are affected, within the family, because that's where a lot of people don't know where to go. So give us a call, all right, or reach out to us. We're familyandaddictionexperts.com, and we are doing our best to heal families shattered by addiction. All right, take good care. Thanks so much for joining our podcast, Healing Families Shattered by Addiction. We'll be back in a couple of weeks with more important tools, techniques, and ways for you to focus on you instead of the alcoholic or addict in your world.
Until then, please go to our website, familyandaddictionexperts.com. That's familyandaddictionexperts.com. You'll also see links to our Facebook and Instagram pages. Please also, if you have any emails that you would like to send us, that's info@familyandaddictionexperts.com. That's info@familyandaddictionexperts.com. With any thoughts, feelings, questions that you may have for us, we would love to hear from you, and we look forward to seeing you in a couple of weeks.